bringing you into this discussion, well, Medicare works well now, and health systems around the world look to Australia for guidance on a successful and effective healthcare system. So why change it?
Well, we're wrong to think that we can't improve it. I think 12 months down the track, you'll find that there'll be very little change in access and certainly an improvement in performance as a result of these budget changes. What's been missing from this debate is the realisation that GPs pocket $2 for every consultation on top of what they currently do at the moment when they're charging people out of pockets, meaning that every half an hour to an hour they can afford to still bulk bill 1 or 2 people every hour who are needy. Now that's been completely neglected from this debate, and I think Richard underestimates the flexibility and the compassion of GPs. We will be, in our practices, seeing people who cannot pay that out-of-pocket amount, bulk billing at the $31 mark, and remembering that the $2 we collect from every other patient will make up for it. So there's enormous flexibility in the system. I think you'll find no change.
But the $2 that you point to for GPs, is that going to be swallowed up in additional admin costs for them?
No, definitely not, because the bulk billing fee will simply revert to that $31 amount and the $7 will be collected. No, absolutely not. That's taken on quite easily by front of office staff. So once again, I say, you see 10 patients and collect $2 each. You've got room then to see 2 or 3 high-need patients at the bulk billing level.
Richard Di Natale, why shouldn't the states run health? It is really their arena. The federal government has bit by bit encroached on that space and promised to fund it as well. But assuming the states can raise more revenue, should it be up to them to have sole responsibility for health?
Of course not. I mean, we have a system where the Commonwealth funds general practice and primary care, and that's a good thing. That's an excellent thing. I mean, our system of primary care in this country with GPs at the coalface is the envy of the world. Why on earth would you dismantle that? When it comes to hospitals, all you need to do is cast your mind back a few years. And what you saw then was a situation where state governments continually blamed Commonwealth governments and vice versa. You had no transparency in the system. You saw all sorts of pork barrelling. At least now the Commonwealth hospital agreement is not perfect, but it's a situation where we've got transparency. We know how much it costs to do a hip operation in a hospital. We know how much the state should pay for it and how much the Commonwealth should pay for it. We're going to go back to the bad old days where we get all this sort of buck passing, shifting the blame from one jurisdiction to another. Why on earth would you want to go back to that time, which actually led to this reform? I mean, the reason we've got this reform is we recognise they were the bad old days when it came to healthcare. And what we've got now is one of the biggest cost-shifting exercises in Australian political history. It just makes no sense. It's a recipe for spiralling health inflation. You see, it fails on the government's own test. It doesn't just make the system less fair, it makes it much more expensive. So it just seems to me to be an ideological exercise.
A response to that, is it an ideological exercise, and will it increase the cost of health and shift those costs to the states?
Look, of course not. We know from international experience, Valencia in Spain and other areas, that increasingly hospitals are having to meet tighter budgets. This was money Australia never had. Julie Gillard dreamt up 10+% increases in health funding. This is money Australia didn't have. Getting hospital growth back to single figures is really important. This is what's happening with this budget. At the same time, there'll be primary care reforms, bringing GPs closer to hospitals and their specialists, dealing with what we call the frequent flyers, the chronic complex comorbidity patients. We will get that under control, reduce hospital expenses, and those hospitals, as we're seeing in Queensland, can keep within budget and deliver the services that locals need.
A response to that, Richard Di Natale?
I just say this. You tell a person who's on a 6-month waiting list to have a knee replacement, or somebody who spends the night in an emergency department waiting to get treatment, that it's a good idea to be ripping out billions of dollars from our public hospitals. You put that proposition to any ordinary person who's already acknowledges that we've got a health system and a public hospital system under strain, and you say to them we're going to rip billions more out of our public hospitals.
All right.
I mean, it is laughable.
I'm being told we have to wrap it up there, I do appreciate both of you coming on to debate what is a very important element of this budget. Richard Di Natale and Andrew Laming, thanks for your company, and thanks for your company at home. That's all we've got time for on Saturday Agenda. I'm David Lipson.